Hello, everybody, and welcome to today's session for your Human Growth and Development online course. This is our pre to last topic, and today we're going to be covering congenital abnormalities. So, just as an introduction, we need to obviously know what congenital abnormalities, or sometimes they're called congenital anomalies, we need to know what they are. And by definition, these are defects that arise in the fetal body as a result of an abnormal developmental process. So, if any of the stages of development are defective, so for example, if there's a problem with the primitive streak appearing, or a problem with the folding of the body, or a certain population of cells doesn't migrate the way it's supposed to, then that results in a congenital abnormality. Now, some congenital abnormalities may be visible externally. So these are usually found when, the mother goes in for an ultrasound, and then the doctor is checking the baby through the device, and then he'll physically, or he or she will physically see that there is a problem with the baby. So, for example, they can see that if they have shorter limbs, or if they have a limb that didn't develop properly, or if the facial features are abnormal, or something like that. They may also affect the internal organs. These can be discovered on ultrasound, and in some situations they're not discovered unless the child is born and then starts developing symptoms or getting sick first. Regardless of the time of discovery, the child has to be born with the condition for it to be classified as congenital. Okay, so that means that if a child is born normally, because normally what happens is as soon as the baby is born, they do an examination. They actually call in a pediatrician and they do an examination of the baby to make sure that everything is okay. All right. If they develop certain symptoms or features of a disease later on, and then they do another workup and they don't find anything wrong with the internal organs or such, then this is not considered a congenital defect. This is just a normal illness, okay? But if the baby or the child develops symptoms and then, they suddenly discover that there's a hole in the heart, for example, then obviously that would be considered a congenital abnormality, even though it was discovered later on. Now, there are certain susceptibility periods, meaning that there are certain times of development when it is most likely for congenital abnormalities to arise. And these are any periods that have a high rate of cell division. And I'm pretty sure you guys can guess which ones those are. They are the early stages of development, which is the germinal period, which is basically that phase where fertilization happens, and then the formation of the bilaminar germ disc and the trilaminar germ disc, and all that early period. This is considered the germinal period. Usually these embryos don't make it to the later stages of development, usually, and then the mother will have a miscarriage. The other susceptibility stage is the embryonic period, which we already mentioned is a stage of very high or rapid rate of cell division. So again, that's a time where things could go wrong. Now, there are a lot of different causes of congenital abnormalities. We're just going to list them out now. And the commonest one, or the most easy one for you guys to probably guess at this point, would be genetic or chromosomal abnormalities. Okay, so you all know that in order for an organism to be normal, it has to have the required number or normal number of chromosomes. In any situation where the chromosomal number is either increased or decreased, or for example, there's a problem or a defect in the DNA for any reason, then that will result in a congenital abnormality. Maternal diseases also cause problems in development. Remember that the mother and the baby are connected through the placenta, and the maternal blood and fetal blood come in communication or come in contact at a certain point. Even though there are barriers, but there is going to be mixing and diffusion between the two bloodstreams. So basically, anything that affects the mom can in turn affect the baby. So, for example, if she has a certain infection, and let's just say that organism can cross the placenta, then that will end up affecting the baby as well. If she has diabetes, and that means her blood sugar levels are very high, and then that high sugar can end up diffusing and reaching the baby and then affecting the development as well. If she has high blood pressure, obviously that's going to cause a problem with the blood flow. There might be too much blood flow. There might not be enough blood flow. So anything that affects the mother is directly going to affect the baby. Again, maternal habits, like I said, the mom directly influences or affects the baby. So if she's, I mean, we might not see this a lot in Sudan, but, or maybe we do, I don't know. But if she has any habits, things like smoking or alcohol consumption, or if she takes drugs for any reason, then again, this can end up, any of these substances can cross the placenta and then affect the fetal development. Teratogens, which are medicinal drugs that have the capacity to cross the placenta. Now, this differs from point number 3, because with maternal habits, things like smoking and alcohol consumption, these are things that the mother is choosing to consume. Okay? With medicinal drugs, this usually means that the mother has a certain condition that is forcing her to take this medication. So she either has a certain illness or a certain pregnancy-related condition, and she has to take the medicine. And then if that medicine has the ability to cross the placenta, then obviously it's going to affect the fetal development. And that's why whenever drugs are being prescribed to pregnant women, they have to be marked as whether they are safe for pregnancy or not. And if a drug is known to cross the placenta and known to cause some sort of congenital abnormality, then they have to find some alternative, especially if she needs the drug for treatment purposes. Okay, so that was just the causes of congenital abnormalities. Now, this is a huge topic, and you're going to get it in more detail when you guys go on to do pediatrics in 5th year. So what we're going to do now we're just going to look at examples of congenital abnormalities. I don't need you guys to know the entire list, but we're just going to look at examples so that you guys can get an idea of what congenital abnormalities look like. Okay, so first of all, we're going to look at Down syndrome. Down syndrome is a congenital anomaly that results from a chromosomal defect. Okay, so it's one of the congenital abnormalities caused by a problem with the chromosomes. What happens is something called non-disjunction of the maternal chromosomes at position 21. Now, you guys know that the chromosomes are set out in pairs in certain positions from 1 until 23. Okay, and since there's 2 copies, there's going to be 46 chromosomes. And then during cell division, obviously we said at one point the chromosomes need to separate from each other. So what happens here is that the chromosomes at position 21 do not separate during cell division. So this results in a zygote with 3 chromosomes at position 21, which are the 2 chromosomes that didn't separate from the mother, in addition to the 3rd chromosome at position 21 from the sperm. Okay? And this obviously happens after fertilization. And therefore, it is known as trisomy 21, meaning that there are 3 chromosomes at position 21. Children born with trisomy 21 usually have characteristic facial features, so they have a certain facial appearance that that will basically allow you to recognize them as having this chromosomal defect. Trisomy 21 also puts them at a high risk for heart defects. So this congenital anomaly or this chromosomal abnormality results in defective heart development and also results in defective development of the GIT. So with a genetic map, what we're looking at is the distribution or the arrangement of the chromosomes and their specific positions. So notice how at every position from 1 until 20, there are 2 copies of the chromosome. However, when we get to position 21, we find 3 copies. So that means that their genetic makeup puts them at having an extra chromosome at this position. And this is what a baby with Down syndrome looks like. Okay, now if you've ever interacted with someone that has Down syndrome, they are the most pleasant people. They are so cute and just adorable. But notice how they have slightly slanted eyes. So the external corner of the eye is directed slightly upwards. They also have something called low set ears, meaning that their ears are slightly lower position than normal. And they also tend to have a flat nasal bridge, so their nose is a little bit flat. So, like I said, characteristic facial features of a certain chromosomal abnormality. Okay. The next congenital abnormality we're going to look at is something called an omphalocele. Now, this is a congenital anomaly that results from defective embryonic folding. Okay, so this is one of those incidences where there is a problem with one of the processes of development during the embryonic period, and this results in failure of formation of the body wall. Okay, so if you guys remember, there was there was folding of the embryo, and then the sides of the body just kind of came together and formed the anterior body wall. So when that process is defective, it results in this condition. It results in gastrointestinal organs that are located in a sac outside the body. Now, if you remember with the session about the fetal membranes, I spoke about how the rate of development of the intestines is too fast when compared to the growth of the body. And because of this, the intestines get pushed out of the primitive umbilical ring, and then once the body has reached a certain size, they go back again. So with this condition, because of the defective folding, the organs or the GIT organs just kind of are pushed outside the body, and then they just stay there. They don't go back. So you can see here, this is a baby, and you can see that he has all of these GIT organs. There's the intestines, I think that's part of the liver right there, and there is a sac covering the organs, and obviously you can see here, this is the line where the body defect is. So the body wall did not form properly, and as a result, the intestines just kind of stayed in a sac outside the body. With amelia and phocomelia, this is a condition where the limbs develop abnormally. With phocomelia, this means that the limbs are short and they are exceptionally close to the body. And with amelia, the limbs do not develop at all. So this is what phocomelia looks like. You can see that the limbs have started to develop, but they are extremely short, they're very close to the torso, and they are even in abnormal positions. You can see the lower limbs are kind of turned externally, the foot is facing upwards. Here the fingers haven't developed properly at all. So this is what phocomelia looks like. There was an outbreak of this condition back in the 1960s, which is like eons and eons ago, and this happened in Germany, and it happened because of the use of a teratogenic drug which was called thalidomide. Thalidomide has now been banned from use because of this condition, But originally they started using it because it was used to treat nausea that is induced by pregnancy. So pregnancy generally causes a lot of GI disturbance. It causes nausea, it causes vomiting. So thalidomide was an example of a drug that was able to treat this condition. But once they discovered that it caused this congenital abnormality, it was banned from use. Okay, and I realized that this is just an example, because mostly there's been a lot of research and there's a lot of awareness about what drugs cause congenital abnormalities and their use during pregnancy. But this is just an example that I wanted to show you so that you guys understand that drugs can cross the placenta and cause congenital defects. Okay, we're going to look really quickly at heart defects. I realize you guys didn't take the development of the heart in detail, and don't worry, you don't need to know it right now. But again, this is just an example that I hope will help you guys understand the concepts of congenital defects. Okay? Now, normally, when the heart develops, at one stage, there is a mesodermal growth in the midline. And what this mesodermal growth does is that it divides the heart into a right and left side. Okay? In certain cases, regardless of the cause, whether it's genetic or whether the mother was taking a certain drug or whatever, or if she had a certain disease, in certain cases, this process is incomplete and it leaves what we call a septal defect in the heart. So that means that instead of the heart being divided into separate right and left sides, now there is an opening, and then it's kind of like it's just one single chamber in the heart. This leads to the mixing of oxygenated and deoxygenated blood as well as pressure abnormalities. Okay, so let's look at what a normal heart looks like. Okay. Generally, the heart is divided into a right and left side, and you can see here down the midline, this is what we call a septum, okay, and it divides or separates the right side from the left side. Normally, the right side carries deoxygenated blood, where the left side carries oxygenated blood. That's why usually the right side is indicated in blue, and the left side is indicated in red. Okay. The other thing is that the right side is connected to the lungs, and the left side is connected to the rest of the body. So usually what we find is that the pressure in the right side is lower than it is in the left. And again, that means that the right side is adapted to deal with low pressures, whereas the left side is more adapted to deal with high pressures. With septal defects, so for example, let's look at ventricular septal defects. Notice how the right and left side are now communicating with each other. Here, there is a complete wall, a septum, separating the two sides, but now there is a hole, and the blood can now mix. Now, the problem with this defect is, like I said, the pressure on the left side is usually higher than it is on the right. But now, since they're open together, that means this pressure causes the blood to be pushed from here to here. So it pushes from the left side to the right side. The right side is not adapted to deal with large amounts of blood under high pressure. Okay, it's just not adapted to do that. And so this ends up causing a lot of problems with breathing. It ends up causing a lot of problems with blood flow, and it can result in lung infections and defects like that. Okay? So in summary, the things I need you guys to understand from this topic, like I said, this is just an introduction. It's not all the details of congenital abnormalities, but generally they are defects that the baby is born with. They may be discovered before or after birth. Regardless of their timing, they have to be born with them. They can happen due to several causes, and usually these need to be monitored during pregnancy. So if the mother is known to have a certain disease, or if she has a family history of a congenital defect or a family history of a chromosomal abnormality, then the doctor in charge needs to pay close attention to this. And usually after birth, they require a lot of condition-specific care. So, for example, babies that are born with heart defects might end up needing surgery. They also need certain medication to lower the blood pressure problems that they have. Um, if they're born with their intestines outside the body, again, they're going to have to need surgery to get them back inside and remove the abnormal sac and then make sure that all the organs develop normally. Um, so most congenital defects usually require surgery, especially if they're physically, externally visible. All right. So for those of you who don't know, I am a huge Disney fan. Yes, that's right. I am 32 years old and still a fan of Disney. And this is one of the quotes that I like from The Lion King, which is an old Disney movie and a classic. Um, but Rafiki said to Simba that the past can hurt, but you can either run from it or learn from it. And I think this year has been a good example of a year that has hurt all of us, one way or another. But I think the best thing that we can do is learn from it and use this time to become better versions of ourselves. So, that is all I have for you guys today. I hope this session was useful, and I will see you guys next time.